The Asian American Center of Frederick was incorporated as a 501c3 nonprofit organization in 2005. Since then, it has worked tirelessly to reach its vision of equity for all persons. It has done this by striving to enhance, enrich, and empower, thereby reaching its mission to provide all immigrants with essential skills to be independent and successful contributors to our communities and society at large. Executive Director Elizabeth Chung.
I am Elizabeth Chung, the Executive Director for the Asian American Center of Frederick. I founded this agency out of the love for my communities who need after-school reading programs, studying programs. It has been 20 years, and now that we are a very vital agency in Frederick and located in 5 different places. We continue to work with hundreds of communities, building capacity, erasing barriers, improving workforce for bright futures for all families to come.
Over the years, a number of programs have been developed, each serving a specific need in the community, giving special attention to the needs of immigrants and other disenfranchised persons. First, let's take a look at our citizenship and immigration services. Its focus is to help immigrants gain English language skills. Civics classes are also provided that help the person clearly understand what it takes to be productive citizens who give back to the country they now call home. Dr. Matthew Nimson manages the CIS program.
From time in and time out, people just walk through our doors and they are very, very happy about the type of service that they receive. And not only that, about the kind of person-to-person interaction that we give them.
This enables the immigrant to successfully pass the citizenship test, while the ESL classes provide skills and communications for daily life. And speaking of languages, AACF offers translation and interpreter services in medical, legal, and other essential situations. AACF's trained and certified interpreters easily bridge the communications gap by overcoming any potential language barriers. If you find yourself in need of translation and interpreting services, feel free to contact AACF. We will quickly arrange for a language expert to help you. Employers are always looking for skilled workers, and AACF has programs supporting workforce development. Particularly in the healthcare field, our community healthcare workers are trained at AACF and then certified by the state of Maryland. They work in community settings as a connection between healthcare consumers and providers. Their work promotes health for persons that have traditionally lacked access to adequate health care.
Always help our staff, in particular community health workers. We need to reach health equities. Health equities meaning equitable healthcare services or accessible healthcare services. By them coming from the communities, they absolutely have a good sense about the challenges. They're out there, they know it, and because they're so much part of a community, they understand then also directions in terms of our health policy or health services.
We are the first CHW in Frederick County. To be a CHW required trainings, required to be available to working with the community. The impact is a big impact. CHW is the gap between the patient at the hospital.
Beneficial for community health workers to reflect the community that they're serving, because in doing so, those residents who maybe don't speak English as well as others, or who aren't as familiar with some terms in the medical industry, having a community health worker provide that support of not necessarily translation, but sort of cultural navigation can help people better connect to the health system.
I really believe that CHW is the future of the healthcare.
And our apprenticeship program helps with placement and finding the right fit so the newly trained professional can best utilize their skills. Our family support services provide early childhood education to children from infancy to age 5. At the same time, developmental activities are arranged so that parent and child grow together, resulting in the entire family becoming a stronger unit. Finding basic healthcare services is often a challenge for immigrants and other disenfranchised persons. For almost 2 decades, the Asian American Center has led the way in organizing an annual health fair. In partnership with other healthcare providers, basic screenings and referrals are made available. The results can be potentially life-saving. AACF volunteer support includes our Retired Senior Volunteer Program and Senior Companion Program, both of which prove you're never too old to make a difference in the community. The programs draw on the strength of the skills and experience of those over 55 years of age. Other programs include our Golden Gatherings. Throughout the year, a variety of cultural events share the food, music, art, and heritage of various Asian countries. It serves to build understanding, to celebrate diversity, and just have fun. AACF is also a proud host to members of AmeriCorps and Maryland Corps programs. For more information about our organization or any of our programs, please contact the Asian American Center.